Welcome to episode number 4 of Dr. Brandy's Pearls. I decided to do a little podcast on NP versus MD related to our education, our practice, and our clinical hours. And I posted this question in my Facebook group of NP Real World Survival, just wondering what other NPs thought in that group on this topic, considering that I've kind of ran into some various topics that have brought some light to this over the last week or so. And not that I haven't heard these things before, but I decided that now I wanted to speak my thoughts on this. So there's this big conundrum of issues that are coming up around the fact of nurse practitioners having independent practice from physicians. And so many physicians that are so angry about that. And I'm really confused as to why it's such an issue. Nobody has ever said that we as NPs are somehow comparing ourselves as MDs. And from what I've known from my education throughout the years, nursing was here before medical doctors were here. We've had nursing well before most people even knew what medicine was. So I think that we've marked our place in history a long time ago. But with that being said, nurses are truly the backbone of healthcare, period. And I don't feel like nurse practitioners are trying to take over an MD's spot in the healthcare system. I do believe that we can be head of healthcare teams. As nurses, we are head of healthcare teams. You know, oftentimes physicians forget that we're kind of the people that brought them through medical school, because most of us have been working in the field of healthcare before they even got an opportunity to step on a floor or touch a patient. We were already working. I truly believe that there is a difference in our education. And I think that it's a difference in the way that we view our patients. I believe that majority, and I'm not going to say all, because some have adopted, different perspectives of how they deal with their patients, but many of them look at their patient as a disease. We as nurses look at our patient as a whole, a holistic view. We look at mind, body, and spirit. So our goal is to hit every point of that patient, not just the disease itself. It is us that have to take on the whole perspective of how that patient is being taken care of. Education-wise, there is a difference. I believe that as nurses, we get into this field a lot faster and a lot sooner. The 2 years that they're still trying to do pre-med prerequisites that actually go along with what we do as nurses, we're already on the field. We've already graduated with a bachelor's degree, and we're ready to hit the ground running and take care of patients. And many of these physicians that are in medical school, they're in medical school for another 2 to 3 years doing basic nursing, in a sense, and learning basic nursing education that we've already learned. We've already learned our anatomy and physiology. We've already learned organic chemistry. We've already done, disease processes and talked about medications and so forth, things that they have yet to do. We've already talked about the politics in healthcare and health administration and so forth. So I think that in a lot of ways gives us an advantage over them. Because while they're still in their master's education, learning things that we've already surpassed once we hit a master's education, it kind of gives us leverage in that sense. I honestly feel as though that many nurse practitioners should have a minimal time that they should practice. And I believe that a minimum of 5 years, they should be in the field of nursing and have had a variable background before they decide to go into a master's program for a nurse practitioner. And I think that the reason why, of course, we don't have an extensive 4-year master's / doctorate type scenario is because we've already done a lot of the things that many physicians have not. Physicians, I think they forget that they're coming from a nothing background versus nurses who many of us have been in the field for a while. And when we go back to school, it's only to advance and actually build upon what we've already known before we got to this point. They're learning from scratch. And we do additional clinical hours, in our programs for master's as well as doctorate, but they forget that there's so many on the job actual hours that we've done prior to that more than calculate either equally or more than what many of those physicians have even had an opportunity to do. And I believe that many of them include a lot of their experience as part of their residency as making them, somehow more superior. Just because someone didn't do a physician residency didn't mean that they've never done a residency. Many of us go through a rigorous training program in the area that we want to practice in, whether it be as a bachelor's level nurse or as a master's level. That is where we start gaining that information. And I think that, at the end of the day, it's not really a competition, nor is there a comparison, because the way that we get and derive to the same point is neither here nor there. The fact of the matter is that we get to the same point. But me as a nurse practitioner and as a nurse that has been practicing about 17, 18 years now, I don't like being disregarded or being down in any type of public manner as if somehow I'm not bright enough, I'm not skilled enough in order to get there and to do the things that they do. I have many physicians that come to me for education, for answers, for help, even for training for things, because they have no clue what it is that I know. They haven't learned it. We all have to learn things from different areas and from different people. We don't all know everything. And last I checked, many of us nurse practitioners have great patient outcomes. I think the biggest drawback for many nurse practitioners as they get into this role is the lack of confidence and the fact that they allow that many of the naysayers out there keep them from feeling confident in what it is that they've already learned and what they already know as practitioners. You've learned it as a nurse. You're only building upon what you've already been doing the last umpteenth years you've been working as a nurse. I also believe wholeheartedly that if nurse practitioners are precepted by too many physicians, they don't really learn the things that they need to learn. Because I do feel there's a large group of physicians out there that are setting nurse practitioners up to fail by not utilizing them as respected colleague providers, but treating them as nurses or MAs that are somehow beneath them. And I think that we really have to learn how to start playing on a level field. And I think that it's not just on a physician side, but I think it's on nurse practitioner side. Some of the comments that I even seen when I stated this question were very, very disturbing to me. And this is just my opinion, of course. People felt like somehow MD's education is superior. I don't feel that way at all. I don't. That's just like saying, that other professionals in other areas have superior education. I don't believe that. I just believe that you have now mastered the area that you have decided that you wanted to have a career in. Doesn't make it superior. Do I believe nurse practitioner schools need revamping? Wholeheartedly. Definitely. There's many things that they're lacking that would only improve the outcomes for many of those that are actually graduating. Do I believe we should have residencies as nurse practitioners? Yes. I believe they should be equivalent to the medical physician residencies to an extent. We should actually be side by side doing these residencies for certain areas. Do I believe nurse practitioners need residencies for primary care? No. I believe primary care is very straightforward. I believe that if you've been working in nursing and in healthcare long enough, you will easily adapt to that area. But if you're a nurse who decides, I just want to go straight through from my bachelor's to my doctorate, guess what? That's not the way to go. So yes, you will struggle and you will feel the way that you feel. And yes, you should be in a residency program. But being in a residency program for 5 years, 10 years, does not make you a superior provider over someone because you stayed in a residency program. That just meant that you stayed under somebody's wing that much longer. I believe that we need to start looking as nurse practitioners as putting ourselves on an equal playing field. I believe that physicians need to look at that as well. Nobody wants to take their position or wants to take their jobs. There are trillions and billions and trillions of people out here that need health care. We can all take care of these patients. If the world was to end tomorrow, then what? What if there was nothing but nurse practitioners here? What if there were nothing but physicians here? There's plenty of physicians I know that wouldn't know how to start an IV, let alone wouldn't know how to truly assess a patient, because they don't bother to do it in their real practice. They minimize what they do. We need to stop glorifying certain areas of healthcare and start looking at it as a team, as a healthcare team, which is what we've been saying for years, but yet we don't really truly practice those things. We do not say those things. We do not treat each other as team members. We treat people in a level of who's superior over the other. I don't have a supervising anything. I have collaborative physicians as well as collaborating NPs that I work with, because I'm very confident in what it is that I know at this point, and I feel like others should get to that point as well. Many of these physicians were not exactly at the same level that they are now. Many of them have started out just like we did and were timid and green and wanted to know things and had to learn things in order to be at a good level. And some of them still don't have all of what it takes to be the head of anything. Some of us as nurse practitioners have that. We have that training. We have that education. We have been there. So I believe that there is no debate. There is no comparison at this point. I believe that we got to the same end result in different pathways, and we have to understand that. And those nurse practitioners who feel a doctor is superior over you, you probably need to rethink that thought process, or even about being a nurse practitioner, because your patients will not have the same confidence in you as they do a medical doctor if you don't have it in yourself. Take it from me. You have what it takes if you believe in yourself. Physicians are drilled that they are superior throughout their time of education. I know physicians who believe that most doctors are very stupid, and that if it was not for nurses, that they wouldn't get where they are. So as you guys continue down this road as nurse practitioners and you hear these debates, stand up for yourself. Stand up for our career, our professional stance, our education. Stand up for it. Stop demeaning it and adding to the fire. We deserve to have the same independence as an MD. We do. We've earned it. We've gained it. We've fought for it. We went to school for it. You've paid hundreds and thousands of dollars for education for a reason. But that's my pearl today, and that's my soapbox. And I thank you all for joining me, and look forward to my next podcast on cash practices for nurse practitioners. Stay tuned for the next one. Have a great evening.